Hi, welcome to Prescribing PrEP for Peace of Mind in the context of serodiscordant relationships, a qualitative analysis of Australian providers' views. My name is Anthony KJ Smith, my pronouns are he, him, and I'm presenting this on behalf of myself, Martin Holt, Bridget Hare, and Christy Newman. We'd like to start by acknowledging the traditional custodians. This presentation was recorded on unceded Bedegal country. We pay our respects to elders, both past and present, and to emerging leaders in the Aboriginal community. We also recognise and support the calls in the Uluru Statement from the Heart for a First Nations voice to Parliament and a Makarrata Commission to oversee a process of agreement making with governments and truth-telling about the historic and continuing impacts of colonisation on Aboriginal people across Australia. So this study is from my doctoral research, PrEP in Practice, a qualitative study with the aim of understanding clinicians' views about providing pre-exposure prophylaxis, or PrEP, a combination HIV prevention drug. One aspect of prescribing PrEP that is important is the management of HIV anxiety. HIV anxiety is not a clinical condition, but implies significant concern about being at risk of, testing for, and/or being diagnosed with HIV. Research has shown that PrEP use reduces HIV anxiety, although most of this research is with gay and bisexual men. Clinician views regarding HIV anxiety and PrEP, however, have been scarcely researched in the context of U equals U and serodiscordant relationships. So U equals U comes from the Prevention Access Campaign and stands for undetectable equals untransmittable. And it follows the international scientific consensus that people living with HIV who are taking HIV treatment and have an undetectable viral load cannot transmit HIV through sex. U equals U was endorsed by ASHM with guidance for clinicians in Australia in 2018. And successive versions of the Australian PrEP guidelines have indicated that PrEP is not indicated for a person whose partner's HIV is virologically suppressed. However, prescribing PrEP is encouraged, quote, when an HIV serodiscordant couple experience undue suffering and anxiety about intra-couple HIV transmission, despite the positive partner being virologically suppressed and on treatment. So for this study, we engaged an advisory panel of clinicians and people who represent HIV organisations to support with the study design and recruitment. The people on the advisory panel are listed in the acknowledgements at the end of this presentation. We conducted semi-structured interviews with general practitioners, sexual health nurses, and sexual health physicians in New South Wales and Western Australia who have prescribed PrEP or provided PrEP at least once. We interviewed 25 participants between October 2019 and April 2020, most of which was over the phone, and interviews lasted an average of an hour. Participants were compensated a $125 prepaid debit card unless they were unable to accept this due to their work role. We interviewed 9 general practitioners, 9 sexual health nurses, and 7 sexual health physicians, 17 of which worked in New South Wales and 8 in Western Australia. I coded the data and conducted a reflexive thematic analysis following Brown and Clark's approach. And so this presentation focuses on prescribing PrEP in the context of serodiscordant relationships. So we asked participants whether PrEP was important for a person whose partner was living with HIV. And so this was the common type of response that we got from participants. P6, a GP, said, technically, if they're their only partner and they're relying on U equals U, they theoretically shouldn't need PrEP. So most participants brought up U equals U in their response, and they framed risk of HIV transmission with an undetectable viral load as extraordinarily low, negligible, or a zero risk. So P19, a sexual health physician, says, if you've got a monogamous couple and the person is good at taking the medication, they've got an undetectable viral load and it's been consistent, I certainly don't recommend PrEP in those circumstances. But if there's any other deviation from that sort of scenario, then people are offered PrEP. So then participants offered some other reasons to prescribe PrEP for patients in serodiscordant relationships. So scenarios that fell outside of that one that P19 described. So the most common one was that the couple was in an open or non-exclusive serodiscordant relationship, in which case prescribing PrEP for the HIV negative person was really to protect them from outside of the relationship, from sexual encounters, and not from their partner. Participants also said that they would consider prescribing PrEP if the partner was newly diagnosed with HIV and therefore maybe hadn't had an undetectable viral load consistently. The partner's viral load was indeed detectable, or because the partner was non-adherent to treatment. But also, participants told us that PrEP had a role in managing intra-couple HIV anxiety. So as P23, a sexual health nurse, said, PrEP provides greater peace of mind for people in a serodiscordant relationship. P22, a sexual health physician, elaborated, it might be because they just don't yet quite trust the evidence of U equals U, or they're a kind of belts and braces sort of person who wants to have no risk at all and do everything they can. Sometimes it comes from the positive partner. So I asked P22 to elaborate on this. And they explained that the advice from doctors to people living with HIV had previously been to use condoms with everyone. And now in the era of U equals U, for some people, it's a bit hard sometimes to suddenly have a mindset change. So really indicating that while U equals U is really powerful, it takes time for people to build trust and to have faith in it. Some participants question the reliability of viral loads over time. So P14, a sexual health physician, said, if you're unwell and you've got diarrhea for a week, you probably haven't absorbed your tablets. You're only as good as your last viral load. As good as. That sounds terrible. You're only undetectable based on your last viral load. So if you stop taking medications for whatever reason, you won't remain undetectable. And so while evidence for U equals U was viewed as really powerful, some indicated some limitations or concerns regarding adherence and reliability, and that therefore permitted prescribing PrEP for this potential transmission if not adherent. Some participants also sympathised with patients not wanting to solely rely on partners' prevention. So P18, a general practitioner, said, if it was me, I'd want lots of different layers of protection. So there was an emphasis on the importance of couples feeling safe, in control, sharing the responsibility of preventing HIV, and negotiating trust and power within the relationship. So P15, a GP, said, I guess it's the same with women, you know, where we're the ones that are falling pregnant. We're the ones that need to be in control of the contraception. However, some participants held concerns that prescribing PrEP fundamentally undermined the message of U equals U. So as P11, a sexual health nurse, said, what happens in that case is we drive the stigma that U doesn't necessarily mean you. And I think it instills some anxiety around HIV transmission as well, when actually the message should be really clear that while you're having sex with your undetectable partner, you're not going to get HIV. Similarly, P21, a sexual health nurse, didn't want to feed their anxiety by implying to a patient that PrEP was necessary to prevent HIV when it's clear that U equals U. Overall, participants saw PrEP as complementary to U equals U, so permitting no contraindications for the patient who would be prescribed PrEP, PrEP was viewed as appropriate to prescribe for a serodiscordant relationship. However, participants wanted to avoid prescribing in a way that implied that a person with an undetectable viral load was infectious when they're not. So they saw education about U equals U as important as part of the process of prescribing PrEP, at least for serodiscordant relationships. They also saw referrals to counselling or peer support services as important. They didn't want to just prescribe PrEP. They wanted to make sure to address any underlying HIV anxiety, any causes for that, or to also reinforce the message of U equals U. But clinicians themselves also did hold some doubts about reliability of viral loads, and that permitted prescribing to manage that doubt. So to summarize, participants framed PrEP as usually unnecessary in the context of risk for preventing intracouple HIV transmission. However, PrEP was viewed as useful for serodiscordant couples to promote peace of mind, to reduce feelings of HIV anxiety, and to enable people to feel safe and in control. However, there was some caution about how this was done and whether this would undermine the message of U equals U, and some concern about the reliability of viral load and adherence that clinicians felt. Overall, clinicians reported prescribing in ways to manage HIV anxiety and uncertainty about U equals U, as well as to manage the emotional and psychosocial aspects of relationships. So the findings in this study will be available in a forthcoming publication in the Journal of the Association of Nurses in AIDS Care, and this presentation is just one of 3 themes covered in that paper. So you can contact me to find out more about that. I'd like to thank all the clinicians who took time to participate in this study, and also thank the members of the study project's advisory panel. And finally, our disclosures. So no pharmaceutical grants, and the study was supported by UNSW. Thank you.